Good morning and welcome to Take Your Life Back Today show with Ralf Friedrichs. Today we're going to talk about the withdrawal effects of meth. There are some effects that need to be watched for. Hopefully you are not even doing meth, but for the people in the audience that are doing it and want to quit, these are some of the steps you might want to watch out for some of the effects. As always, I want to give a shout out to my good friend, Dr. Luis Gonzalez from StartingPointMN.com. You can find him at 844-414-8444. www.startingpointmn.com. Dr. Luis Gonzalez can help you with your addiction. He can walk from your addiction to your recovery, hand in hand, 24 hours at a time, one day at a time. He will never ever talk about his past. He is not he's not a therapist or a counselor. He is an addiction recovery coach, and his job, just like mine, is to make sure that you are motivated and you are ready to tackle today in your recovery and look for tomorrow. On the other side of his business, he can turn you into an addiction recovery coach if you have passion, personality, or professionalism, I should say, and you have an addiction background, whether it's your own or dealing possibly with someone else's addiction. Call him at 844-414-8444. That's Dr. Luis Gonzalez at StartingPointMN.com. I want to also give a shout out to GlobalEyeglasses.com, where they are focused on saving you money. They have frames that start at $6, as low as $6, and go up to about $49. Those frames include standard, regular prescription, RX plastic, non-coated, clear lenses. They include a cloth in a case. All that for starting as low as $6. Now you might ask, what if I need to have a progressive? What if I need to have transitions? Why want to make my lenses thinner? Why I want to have polarization glasses? Or I want to have mirror-coated glasses? Well, guess what, folks? GlobalEyeglasses.com has all of that. But you need to go there at www.globaleyeglasses.com, where they are focused on saving you money. And if you have any questions about this particular company, you can reach me at 631-599-0218. I happen to know the company very well, and not only that, but I am a board certified optician, so I can help you with your orders. I can give you all the optics 101 to get you with the proper glasses that you so desperately might need. Go to www.globaleyeglasses.com, where they are focused on saving you money. Also, go to my website at TakeYourLifeBackTodayShow.com. That's TakeYourLifeBackTodayShow.com, and see all of our videos that have posted in the last 2 months. You will find tons of live news about drugs and or alcohol on one or two of the pages, but you have to go there, www.TakeYourLifeBackTodayShow. If you want the 411, which is the information on drugs and alcohol addiction, you can also find information on my other website, www.clearviews.info. Today, we are going to talk about the withdrawal effects of meth. I'm going to read it because this came directly from the CDC, which is the Control Center for Diseases. So I'm going to read this to you, so bear with me. Meth does serious damage, as we all know. But first, what exactly is meth? Meth is a powerful, highly addictive stimulant that affects the central nervous system, also known as meth, chalk, ice, crystal, among many other terms. It takes the form of white, odorless, bitter tasting, crystalline powder that easily dissolves in water or alcohol. It's a very dangerous drug. Meth can be smoked, snorted, injected, used via suppository, although we try not to think about that. People who use meth for recreational purposes do so because of the intense feelings of euphoria it causes. The real effect of meth comes from the intense and almost delusional feelings of invincibility. It is without doubt one of the most intense highs anyone can feel, and I hope you don't get too curious and try it, because the purpose of this is to keep you away from these things. The effects of meth usually last for about a few hours to one day, depending on how much the person took. Meth kicks in very quickly and is not long until the abuser will experience a series of physical, psychological symptoms withdrawing from the drug. Physical symptoms of meth withdrawal. The physical withdrawal symptoms of meth are very uncomfortable. Withdrawal effects and their severity will differ from the person to person, but there are physical signs that are very common from person to person. The physical signs are anorexia, or lack of interest in food, hyperactivity, increased heart rate, diarrhea, constipation, itchiness, poor vision, acne low or high blood pressure, rapid breathing, and in worst cases, meth addiction can cause heart attack, stroke, and even death. Even with the pain associated with physical effects of withdrawal, most meth abusers report the real problem is the psychological effects associated with it. Psychological withdrawal from meth. In addition to physical addiction, meth abusers will experience a multitude of the following symptoms: significant anxiety, confusion, insomnia, mood disturbances, and violent behavior. In some more serious cases, abusers will experience psychotic episodes. If you have ever seen anyone experience any of these symptoms, you may understand firsthand how traumatic these episodes can be for this person. The abuser may experience hallucinations, which are both auditory and visual. They may suffer from intense paranoia, usually that someone is out to get them, or may even experience intense delusions. For example, many people say they have insects crawling underneath their skin. All of this may sound like something out of the science fiction novel, but in reality, these psychological withdrawal effects are not uncommon for people coming off meth. The reason for such strong effects deals with the changes that meth brings to the brain chemistry. Studies in chronic meth abusers have also revealed severe structural and functional changes in the area of brain associated with emotion and memory, which may account for many of the emotional cognitive problems observed in chronic meth abusers. Meth can be permanently destroyed. Dopamine receptors making the effects last a very long time, even years. There are many reports of recovered meth addicts suffering from severe depression, anxiety, loss of sex drive, and unstable emotional behavior. Studies have also shown that the brain can heal itself over time. Treatment for meth addiction. Most meth addicts are forced to attend detoxification facilities where there are structured treatment available for either the patient or for either inpatient or outpatient. Cognitive behavioral therapy is often the therapy of choice for treating many drug addictions like meth. This therapy aims at treating thoughts and cognitive, which is directed in correcting errors and modifying the core belief that lead to faulty thinking of these actions. Detox in a safe and clinical medical center is always your best bet. Oftentimes, meth users are also detoxing from other drugs, such as opiates, so they may need to receive medical treatment for other withdrawal symptoms. In the process of quitting meth, a person may experience severe depression, anxiety, psychosis, suicidal thoughts, and sleep problems that last longer than 1 to 2 weeks. They might be treated with medication like antidepressants, anti-anxiety medication, and antipsychotic medication, or possibly also some sleep aids. Meth can be difficult to treat because there are so many of the lasting problems are psychological. Medications are often prescribed to treat the symptoms, but returning the brain chemistry to normal takes time and long-term non-use of any, and I repeat, any drug. The most effective treatment are those that are multifaceted and may include cognitive behavioral therapy group and individual counseling, education on drugs, addiction, relapse, and a program. After learning about all the facts of meth withdrawal, it may seem like a nightmare, It may sound like there's a lot for you to do, but know this. For many people, it may be. Maybe for you, maybe not for you. But it's not to say recovery from meth addiction isn't possible, because it is. With support, determination, and guidance, many meth addicts recover and stay sober for their entire lives. Many of these recovered meth addicts use the experience to help other people who may also have had problems with meth and withdrawal effects, kind of like me with alcoholism. Quitting meth is a very serious life choice. Meth has very destructive qualities within it, and it is especially harmful to your body. Your best option is to detox and then attend an addiction treatment center. Too often, people try quitting meth without professional help, and rarely does it ever work. If you're trying to detox from meth, you need to find and you need to get professional help. That's really the bottom line. You cannot beat meth or any hard drug on your own. Alcoholism is tough enough to beat on your own, but a drug affects so much more than alcohol can. Alcohol mostly is short-term. Meth, crack, coke, those are long-term effects on you. Let's do a recap on withdrawal effects of meth. First of all, what is meth? Meth is a powerful, highly addictive stimulant that affects the central nervous system, also known as meth, chalk, ice, and crystal, among many other terms. It takes a form of white, odorless, bitter-tasting, crystalline powder that is easily dissolvable in water and alcohol. Meth can be smoked, snorted, injected, or used via suppository, although we try not to think about that scenario. People who use meth for recreational purposes do so because the intense feeling of euphoria it causes. The real effect in meth comes from the intense and almost delusional feelings of euphoria and invincibility. It is without doubt one of the most intense highs anyone can feel. The effects of meth usually last for a few hours to one day, depending on how much the person had used. Meth kicks in very quickly, and it's not long until the abuser will experience a series of physical, psychological withdrawals from the drug. What are some of the physical signs of meth withdrawal? Anorexia, or lack of interest in food, hyperactivity, increased heart rate, diarrhea, constipation, itching, poor vision, acne low, high blood pressure, rapid breathing in the worst cases, and in the worst cases, meth addiction can cause heart attack, stroke, even death. I say this very slow because I want you to hear the effects. Anorexia, or lack of interest in food, hyperactivity, increased heart rate, diarrhea, constipation, itchiness, poor vision, acne low or high blood pressure, rapid breathing, and in worst cases, heart attack, stroke, and death. Those are physical signs of meth withdrawal. That's why you need professional help. That's why you need someone to clinically be there for you. What are the psychological signs for meth withdrawal? Significant anxiety, confusion, insomnia, mood disturbances, violent behavior. Significant anxiety, confusion, insomnia, mood disturbance, and violent behavior. Those are psychological signs of the withdrawal effects of meth. In more serious cases, abusers will experience psychotic episodes. If you've ever seen anyone experience these symptoms, you may understand firsthand how traumatic these episodes can be. What are the treatment for meth addiction? Most meth addicts are forced to attend a detoxification facility where they are structured treatments available for either inpatient or outpatient people. Cognitive behavioral therapy is often the therapy of choice for treating many drug addictions like meth. This therapy aims at treating thoughts and cognitive, which is directed to correcting errors and modifying the core beliefs that lead to faulty thinking and actions. Detox in a safe and clinical medical center is always your best bet and always recommended. Oftentimes, meth users are also detoxing from other drugs such as opiates, so they may need to receive medical treatment for other withdrawal symptoms. In the process of quitting meth, a person may experience severe depression, anxiety, psychosis, suicidal thoughts, or sleep problems that last longer than 1 to 2 weeks. They might be treated with medications like antidepressants, anti-anxiety medication, and antipsychotic medication, sometimes even some sleeping aids. Meth can be difficult to treat because so many of the lasting problems are psychological. Medications are often prescribed to treat symptoms, but returning the brain chemistry to the normal takes a very, very long time. The most effective treatment are those that are multifaceted and may include cognitive behavioral therapy, group and individual counseling, education on drugs, addiction, relapse, and a program, folks. After learning about all the facts of meth withdrawal, it may seem like a nightmare to even attempt it. For many people, it may be. Maybe for you. That is not to say recovery from meth addiction is not possible, because it is possible. With support, determination, and guidance, many meth addicts recover and stay sober for the entire rest of their lives. Many of these recovered meth addicts use their experience to help other people who may also have problems with meth and withdrawal effects. Quitting meth is a very serious life choice. Meth has very destructive qualities to it, and is especially harmful to your body. Your best option is to detox and then attend addiction treatment center. Too often people try quitting meth without professional help, and rarely does it work without the help of professionals. Folks, the answers to the effects of withdrawing from meth are right here, and the warning signs and the repercussions of using meth. So if today is not the day for you to decide that it's time for you to change your life, I don't know what will. I'm not sure of people in my audience who is using meth, who is using crack coke, who is using alcohol. But the one connectiveness that we all have that are still using is just that we're abusing. We are abusing alcohol. We are abusing drugs. And that abuse eventually will kill you. So today, I beg each and every one of my audience to please consider changing your life. Please consider taking your life back today. I want to remind each and every one that not all of us will have it tomorrow. Some of us watching, whether it's this show, some of us sitting anywhere in the globe, could be as far as Africa, be as close as our community. We'll take our last breath today. We'll close our eyes for the last time. And for those people, did they have a chance for change? Were they educated enough on all the different warning signs of alcohol and or drug abuse? This is the purpose of all my videos, is to educate. It's to be the messenger, be the voice of reason, to bring you this information that I do daily on this show, to give you that chance to make that life-changing decision today to take your life back. And if you want to go with the thought that maybe you'll think about it and you might do it tomorrow, remember what I just said. Somewhere on this earth, people are closing their eyes for the last time and taking their last breath. Don't let it be you without change. And why is change so important, whether it's today or tomorrow? for a lot of reasons, but the first reason is to heal yourself. More importantly, well, not more importantly, but as importantly, is when we all do leave this earth, we want to be remembered for being good people. Even if you change today and you should pass tomorrow, and people saw or heard that you had changed, it showed that you had the willpower to change your life. But for the people that continuously want to drink and use drugs, and they go eventually lose their life, those people were remembered, unfortunately, as drug abusers and or alcoholics. Don't let it be you. Start the pattern, start the change today. And it's so simple to do. But the first thing you have to do is stop denying you have a problem. Because if you're drinking alcohol each and every day, or you're smoking pot each and every day, you're doing crack or coke, you have a problem. You are addicted. Doesn't make you a bad person. But what will make you a smart person is to finally admit you have a problem. And when you do that, and you finally admit you have a problem, it is right there and then the change starts. Because the denial is the first 50% of recovery. The second 50% of starting your recovery is to look for hope. To find hope, and how do you find hope? You find hope in a higher power. That higher power is the Lord Jesus Christ. So in combination of your admitting you have a problem and you asking God for guidance and direction, your road to recovery starts today. Your road to taking your life back today starts today. Once you have finally admitted that you do have a problem and you have asked God to be your guider and your director, now it's time to look for an action plan on how do we accomplish our mission in recovery. Will it be to AA? Will it be a treatment center for 30, 60, or 90 days? Will it be other methods? It is very important that you lay out what your structured plan is and you stay on course. In combination of your acceptance of your problem and God's guidance and direction and some sort of support group, you are on your way of taking your life back today. But you will find you might stumble, you might fall. You might have a relapse. And if that does happen, it's okay. You start again. You never, ever, ever give up. You dust your knees and keep going. But the worst thing to do is to go back into your old habits. If you are doing meth and you want to quit today, be alert on these effects that you might experience. These are physical symptoms that include anorexia, lack of interest in food, hyperactivity, increased heart rate, diarrhea, constipation, itchiness, poor vision, acne low, high blood pressure, rapid breathing, and in worst cases, heart attack, stroke, or even death. And these are the psychological things you might experience: confusion, insomnia, mood disturbances, and violent behavior. So make sure, and I repeat, make sure you get a professional person to help you. You can't do this on your own. You can have God help you, but you also here on earth need professional clinical people to walk you through this. And I am here for you each and every day to help you as well. I fortunately never had the desire to use any other drug other than alcohol, and I abused that. And I use my experiences from the past to bring the message to you, wherever you might be. You might be in jail for a DWI. You might be in jail for other reasons, watching me. You might be in the homeless shelter. You might be at home. But wherever you are watching me, the message is clear and it's here today. That you, today, need to change. You today need to admit you have a problem and ask God for guidance and direction. And you today need to start taking your life back, because none of us are guaranteed a tomorrow. I use this example all the time. Your body is like a ship, and your mind is like the captain of that ship. Now, would any captain take their ship into the rough oceans without navigation? Well, right now you don't have navigation. So that's when you have to ask God for guidance and direction. Let God become your navigator of your ship, Captain. And with God's help, you will sail through the roughest oceans in the world, the roughest seas. You will face the biggest problems, but with God's help and your willingness to change, things will change. Positive things will change. You will see changes in your physical sense, your mental, spiritual, and financial senses. But you are the person that has to decide today to make that change. Today is the day. I repeat, not all of us have it tomorrow. Too often on Facebook, I see friends that I went to high school with just passing away. And I say to myself, that could have been me. And I'm sure everyone in my audience has had someone in their life pass away that wasn't an old person. And how many times, how many of you have said that could have been you? Well, it could be. That's why it's so important to change today. Let today be the first day of your new life. Remember, a sober today makes a better tomorrow. That I promise you. And if you think positive, positive things will happen. If you start thinking negative, counteract that with something positive. Think about your children. Think about your family. Think about anything that makes you happy that's positive as soon as those negative thoughts come in. But a sober today gives you guaranteed a better tomorrow. Text me at 631-599-0218 or call my helpline 844-405-HELP and let me help you take your life back today. I'm here for you. I will do whatever it takes to help you. But all I ask in return from you are two things. Your acceptance that you have a problem, stop denying it, and you looking for a higher power for guidance and direction. I can merely just be the person to help you, give you that message of hope, the message of change, the messages like the one today about the withdrawal effects. That is what I'm here for. But it is God's guidance and direction and your willingness for change that will make it all happen. Folks, I hope each and every one of you have a great day, but more importantly, very importantly, is have a sober day. And may God bless you.